Hello everyone. On behalf of the Canadian Mesothelioma Foundation, I want to welcome you to today's webinar. This is the CMF's first webinar, and we are very excited to launch our webinar series with a presentation from Dr. Paul Demers and Dr. Cheryl Peters, who will speak to us today about patterns of mesothelioma and asbestos exposure in Canada. Before I turn it over to Paul and Cheryl, I'd like to start with a land acknowledgement and a brief introduction to the CMF. Next slide, please. My name is Anya Keefe, and I am a fifth-generation settler of mixed English and Irish ancestry. And I would like to begin by acknowledging that the land on which I speak to you from, and that I am privileged to call my home for the last 40 years, is the unceded territory of the Coast Salish peoples, including the territories of the Musqueam, Squamish, and Tsleil-Waututh nations. Wherever you are in Canada, I invite you to take a moment to reflect on the relationship that the First Nations, the Inuit, or the Métis have with the lands that you live, work, and play on. In preparing for this webinar and thinking about the impact of asbestos on Indigenous communities across Canada, we thought about Raven Thundersky, an anti-asbestos crusader from the Poplar River First Nation. Ms. Thundersky grew up in a home that was insulated with zonalite, a vermiculite insulation contaminated with asbestos that was used in government-built housing on military bases and First Nation reserves. She was an activist who advocated in 2008 for a public inquiry into zonalite and pressured the federal government to remove the insulation from First Nations homes. Her fight highlighted the systemic inequity faced by First Nations who had to pay for any testing or removal of the insulation with their annual housing budgets. This was not the case for those who lived in military housing. Ms. Thundersky lost 4 of her sisters and both of her parents to mesothelioma. She died from mesothelioma in 2015, the 7th of her immediate family to die from the disease. She was 50 years old. Next slide, please, Paul. So before I introduce our speakers, I just want to say a few words about the CMF. It is a charitable foundation that was founded in 2008 to serve 3 broad groups of people: mesothelioma patients and their families, healthcare professionals, and those who are concerned with and who advocate for policies around mesothelioma and asbestos. It is dedicated to supporting those diagnosed with mesothelioma, building capacity for mesothelioma research in Canada, and raising awareness about mesothelioma and the hazards of asbestos. This webinar and our upcoming one-day conference in Toronto in 2 weeks are 2 of the ways that we achieve this latter objective. So with that, I'd like to introduce you to our 2 speakers. Thank you, Paul. Dr. Paul Demers is the director of the Occupational Cancer Research Centre, the OCRC, which is housed at Ontario Health. He moved to the OCRC from the University of British Columbia, where he was a professor in the School of Occupational and Environmental Health and the founder of CAREX Canada. As well as being the director of the OCRC, he is also a professor with the University of Toronto's Dalla Lana School of Public Health. He has an MSc in Industrial Hygiene and a PhD in Epidemiology, both from the University of Washington in Seattle. Paul is internationally recognized for his expertise on the health effects of workplace exposures and sits on many expert panels, including the International Agency for Research on Cancer working groups that evaluated carcinogens such as dusts and fibers, firefighting, and formaldehyde. Dr. Cheryl Peters is the principal investigator of CAREX Canada. She started working with CAREX at the beginning of the project in 2007. She is the senior scientist for cancer prevention at the BC Centre for Disease Control and BC Cancer. She is also an adjunct professor in the School of Population and Public Health at the University of British Columbia and an adjunct assistant professor in the Department of Oncology at the University of Calgary. She has an MSc and a PhD in Occupational and Environmental Hygiene, both from the University of British Columbia. Her research interests include occupational exposure assessment, particularly for solar UV radiation, the effects of sex and gender on occupational carcinogen exposures, and exposures in the construction industry. She also holds a BSc in Earth and Ocean Sciences and Geography, and her interest in environmental and occupational health stem from her work as a geologist in northern BC and the Yukon. Please join me in welcoming Paul and Cheryl to our webinar.
Thanks, Anya. I'll take over now, I guess. Thanks for the land acknowledgement. I think that was great. I'll be starting off with the presentation with some history about how we got to this situation with mesothelioma in Canada. As many or most of you already know, Canada was once one of the world's most or leading producers of asbestos. And because of that, we're also a major user, and mesothelioma is really the result of that use of asbestos over many decades. What you see here are the number of cases that are diagnosed annually in Canada. This is from the Canadian Cancer Registry. And although cancer, asbestos causes a variety of cancers and other respiratory diseases, it's easiest to kind of monitor the impact of asbestos when we look at mesothelioma because it's really kind of the best tracked of these diseases. The dark blue line, which is the top one here, is the number of cases diagnosed in all of Canada. And you can see that over this 20-year period, the numbers went up from approximately 300 a year to 600 a year, just a doubling of cases in only a 20-year period. Now, the population of Canada is always growing, so it's important to look at these things as rates as well as number of cases. But you can again see here that the rate has gradually been going up every year, although it fluctuates a bit because it's a rare cancer for these past 20 years or so. Here you see, though, that Canada is in the middle in terms of rates, with Quebec and British Columbia having higher rates than the national average, and Ontario and Alberta having lower rates. And I'm not presenting the smaller jurisdictions because they just jump around too much with small numbers. But really, you can see that they all do cluster around the same area. Now, what has driven that is our use of asbestos, and one way to think about our overall use in terms of volume is to look at how much asbestos was being produced in Canada over these years. Here you see the amount produced each year from the late 1800s till around 2011. The big red line here, the top line, is Quebec, certainly always the biggest producer. But if you add up the other provinces and the territory of Newfoundland that were also mining asbestos, it's not a trivial amount that other provinces were contributing. By around 2010 or so, we were down to only 6% of the global production of asbestos, which is quite a bit down from where it was early on, producing a lot more asbestos. But what's important to remember here is the rates that we're seeing now reflect the fact that it takes 30 to 50 years in general for mesothelioma to develop. So that's what we're looking at. Now I'm going to talk a little bit about Ontario here, not because I think Ontario is the most important, but because I know the most about it in terms of history. Ontario had several asbestos mines that were operating. You saw that kind of little squiggle at the bottom there. It wasn't the biggest producer by far. Overall, during the 60s and 70s, there was probably a total of about 2,500 asbestos miners in Canada. And the last mines closed in the mid-1970s, in part because they could not meet the new occupational exposure limits that were being put in 1973 in Ontario. These were mines that had very high rates of or high levels of asbestos in the air. Particularly the Matawan mine has gotten a lot of attention for this. In this and some subsequent slides, I'm going to give you some results from our occupational disease surveillance system in Ontario, which allows us to track the risk in different groups of people. And I'll tell you that that system, which we started getting records to build it from the WSIB in 1983, uh, had less than 50 asbestos miners in it. And when we linked those 50 asbestos miners to the Cancer Registry of Ontario, so this isn't claims data, this is the actual Cancer Registry data, we see the result that you see here. The hazard ratio, which is a measure of relative risk, was 240. And that means that that's not an error, that's not a typo. It means that these miners had 240 times the risk of mesothelioma as other people in the surveillance system, which covers all kinds of workers. That was based on just 8 cases. That 8 cases occurred among less than 50 workers. So what we're seeing there is a very, very big impact. And it didn't go kind of unnoticed. You can see here, this is from some headlines clipped from the Globe and Mail around the mid 1970s. And there was a lot of controversy surrounding these mines. And in part, it was the outcry from unions and the public that eventually led to the closure of those mines in Ontario. Now, during that period of the 70s and into the 80s, we were still producing a lot of asbestos products in Ontario, and things that some of these things were gradually getting eliminated. But I just have some examples here, that are, probably at the time when I was a child, the artificial snow that we were scattering around the base of the Christmas tree was actually asbestos that was being used for that back in the 1960s or so. Certainly all kinds of building products here. And I know that this is a Canadian seminar, but I've always been kind of impressed with this ad from on asbestos that was from the Twin Towers, and said how important that asbestos was as a safety measure. It was used so much in all of our building materials, but also in other things that you see here, the brake linings. There's asbestos mitts, different types of protective clothing, gaskets, brake pads, and everything else. Now, as of 1980, which was not all that long ago, there were still around 23 different asbestos products manufacturing facilities in Ontario. Generally, they kind of were mostly small and medium-sized workplaces. The largest was around 500 workers, which was the Johns Manville Asbestos Cement Plant in Scarborough, for those of you who know Ontario. But there are also lots of places that produce friction products, primarily brake pads and things like that for the auto industry, gaskets, and other types of things. Many people may have heard of the Holmes Foundry, which is a very notorious manufacturing facility that was closed in 1974. So that's not one of these ones counted in 1980. The levels of exposure in that Holmes Foundry were considered to be the highest ever measured, I believe, in Canada. And there were very high levels measured in the other asbestos manufacturing facilities, at least on the scale of what we think of as health effects now. And certainly you see it here in the results from our surveillance system, where workers in the miscellaneous non-metallic mineral products industries, which is primarily was the asbestos products industries, have 6.5 times the risk of mesothelioma as the rest of the people in that system. This is just to kind of remind people of how much asbestos was being used in really a wide variety of different building materials. So you see here, texture coating, spray insulation, floor tiling, lots of different areas, along with the dates of use. Now, this is when it was put into new buildings, some of which went right up until the ban in terms of some of these things. But a lot of that simply has remained in our buildings. You also see a few things here that are not building products such as brake linings, textiles, and things like that. Now, if you'll notice from those previous slides, we had around 2,500 miners and, perhaps, we had 4,500 people in the manufacturing sector that we were looking at for asbestos products from the 1980s. But there actually were, if you look at things over time, the biggest group of workers that have been exposed are in the construction trades overall. And you see here that construction trades have almost 2.5 times the risk of mesothelioma. And some groups, such as the insulators, plumbers and pipe fitters, painters unrelated, and many others, had higher risks than that. Particularly the insulators had the highest risk that we've measured outside of those miners. So when you think of the numbers of exposed people, this was and continues to remain the most important group, although there are many different groups of people who are exposed. And this is just to give you an idea of how widespread exposure was. We used a lot of asbestos in our, what I would call our hot industries, where they were used for fireproofing things like chemical manufacturing, where it was used to insulate pipes, boilers, and plate works, iron foundries, steel mills. It's also used a lot in electric power. You see here an increased risk among building repair workers. And some people may find this thing of education-related workers to be surprising. The fact is that most of these folks, almost all of them, were not teachers. They were the skilled trades and the maintenance people and the custodians that are responsible for these educational facilities. And all of them built probably before the early 1980s had substantial amounts of asbestos in them. So a lot of our public buildings, including our healthcare facilities, use asbestos to prevent fires. Now, our concept of what was a safe level of exposure has thankfully evolved over time. You can see here the first ACGI-HTLV and the first Ontario Occupational Exposure Limit, which probably reflects some of the other provinces and most of the other provinces in Canada, came in the 1940s. And I've converted this from how we used to measure asbestos in the past, but it's estimated at around 30 fibers per cubic centimeter back then in the 1940s. Now the ACGIH lowered that to 12 in the late 60s. In the early 70s, both Ontario and the ACGIH further lowered their levels, and you can see here they dropped quite a bit, 1980 and early 1990, to where they are today, which is at 0.1 fiber per ml. So from 30, allowing 30 to 0.1. And if you remember, those mines closed in the 1970s just by dropping it to 2 fibers. So very, very high exposures in the past. And if we go back to those mesothelioma cases, and this is just extending out the timeline, you can see the number of cases continues to rise in Canada till 2017, which is the most recent date that we have for all of Canada. Canada has to wait to produce its statistics until it gets data from all the other provinces, and at this point, Quebec only has data available through 2017, so that's what you see here. But if we look at the rates in Canada, not including Quebec, and then just in Quebec, you see again that the rates have been higher in Quebec. But in the rest of Canada, really since 2010, earlier, maybe 2005, we've been pretty well leveling off in our rates for mesothelioma across the country, which is perhaps what you would think about, because that's about 40 years after the amount of asbestos being used in the country peaked. But it takes a long time for us to really see the impact of that. Here you see a more detailed view, and I have Ontario data here through 2021, which is the most recent that I could get from anywhere. And when we put it into a statistical model, you can see pretty clearly here that now our age standardized incidence rates are actually dropping in Ontario. Clearly among men, but also among women. For a while, even after it started to look like it might be dropping in men, it was not in women, but now it looks like in both, which is good news, I think, and a real change that we've had. Now that does make sense given that asbestos mining and use peaked in the 1970s and how high those exposures were back then in mining, asbestos product manufacturing, and we presume in construction, given how high the relative risks were for the workers there. It also means that certainly in those earlier periods too, there was a lot of take-home exposure going on where workers might be bringing asbestos back into their homes on their clothing before we learned how bad that was, and hopefully measures were taken to stop that. But it's important to recognize that over time, our occupational exposure limits have dropped and allowed uses have become more restricted as well. That's what I think has also really driven this decrease that we're finally seeing and hopefully seeing across Canada as more of the data, I hope, comes in positively. However, as you'll hear in a few minutes, asbestos exposure continues in workplaces and homes where asbestos was used as insulation and many other building materials. Now, before I turn it over to Cheryl, who's going to take over the next section of this, I'll let you know that, remind people that things really did begin to change about 10 or 15 years ago in Canada, where I feel as though we kind of turned the corner, where there was widespread recognition. It became more difficult for both the Quebec government and the federal government to support the continued mining of asbestos. So mining stopped in Quebec, partially driven by that, partially driven by maybe market forces as well. But thankfully, it did stop. Interestingly enough, even after that point, we were still importing at least some amounts of asbestos and asbestos-containing products into Canada, and that kind of continued until the point of the ban. Now, if you were paying attention to the news on October 17th, 2018, you probably saw that marijuana was legalized. And unfortunately, that happened to be on the same day that it was announced that we were going to be banning asbestos in Canada. So it kind of overshadowed the news of the asbestos ban, which was a very long time coming and really reflected the work of a lot of different groups and organizations and individuals across Canada who have been working on trying to make this happen for many, many years. So at this point, I'm going to turn it over to Cheryl, who's going to talk more about the current picture of what asbestos exposure looks like currently in Canada.
Great, thanks, Paul. So yeah, as Paul said, I'm going to now take us into more the current state. So it's been great to sort of hear about the history of asbestos use and the impact on mesothelioma rates in Canada. But where are we today, and where can we sort of see ourselves going forward? So a couple of things I just wanted to touch on. Occupational exposure to asbestos persists in Canada and elsewhere worldwide, owing to that extensive presence of asbestos-containing materials that are in our built environment, including our workplaces, but also our homes, which Paul's alluded to. And this is really the primary source of continuing asbestos exposure in Canadian workplaces to this day. And we keep track of this at CAREX Canada. So Paul, can you just go to the next slide? So I know that many of you on the line are probably familiar with CAREX, but I just thought just in case you're not, or it's new to you, or maybe you're not that familiar. So I lead the CAREX Canada project now that was founded by Paul about 15 years ago when we were both at UBC together. So CAREX stands for carcinogen exposure. It was originally funded as a pilot project by WorkSafe BC in 2003, but it's been fully funded by the Canadian Partnership Against Cancer since around 2007. We were originally established at UBC and are now back there as I've moved back to BC about a year and a half ago. The CAREX system isn't sort of proprietary. It was built on a model established by the Finnish Institute of Occupational Health in Finland in the early 1990s that was created for the European Union's Europe Against Cancer program. And the goal of those initial CAREX projects was to estimate exposures in workplaces and really to raise awareness about the occupational causes of cancer. We adapted that structure for a Canadian system. And one of the unique aspects of the Canadian system is that it includes also an environmental component, which I won't touch on today because we're really talking about occupational exposure. But ultimately, what we do at CAREX Canada is we hope to inspire action towards reducing Canadians' exposures to carcinogens, asbestos included. Asbestos is one of our sort of key exposures of interest. And we aim to answer these 4 questions that you see on your screen. So we're taking a look at what carcinogens people are exposed to in Canada, both at work and in their communities, where in Canada these exposures occur, sort of by province or territory. And when I talk about CAREX estimates, because I'm going to show you some of our estimates in a moment, what I mean there is an estimate of how many people are exposed, so a prevalence of exposure, as well as how much people are exposed to. So can we get a sense of whether people are exposed to high levels or low levels of exposure? And next slide, Paul. Sorry, there's just now a leaf blower outside, so hopefully you can't hear that. Great timing. So how did we estimate exposure? So as I said, the project started around 2007. So for our first round of estimates for CAREX, we used census data from 2006. And really that first pass, we used prevalence estimates that were based on CAREX information from the EU, so from that Europe Against Cancer program, and directly applied it to the Canadian workforce with a few minor adjustments. So as you will know from Paul's history, the asbestos mines in Quebec were still in operation at that time. There were no asbestos mines operating in the EU, so we did have to sort of add in some miners that would have still been exposed in 2006. We knew that nearly all available exposure data in Canada at that time was out of date. So it really peaked in our Canadian workplace exposure data base in the 1980s. And so we knew that it was out of date and we were really unable to account for the current Canadian situation in terms of level of exposure. So we knew at that time that this was probably not our best effort, but we sort of, to get all of our estimate for about 50 carcinogens out at the time, we estimated that around 150,000 workers in Canada were still exposed to asbestos as of 2006. And we always knew this was likely an underestimate, and we weren't really able to account for that level of exposure. So you'll see a link to a publication at the bottom there, which does talk about this a little bit and does show our updated estimates, which I'll show you next slide, Paul. So we wanted to do a better job when we updated our estimates for the 2016 census. So we undertook a line-by-line review of each industry and occupation in Canada where we thought there could be asbestos exposure, largely as a result of exposure to these asbestos-containing materials in buildings. We also were able, happily, to remove asbestos mining as a source of exposure because it was no longer happening in 2016. We also used a combination of data to assign qualitative levels of exposure. So we never had these level of exposure estimates in 2006, and we really wanted to do so for our update. And so we used a mix of different data sources, including the US OSHA, the Occupational Safety and Health Administration. They have some exposure data. We did have some exposure data that was a little bit more current in the CWED, the Canadian Workplace Exposure Database. We also used some kind of more unique ways of getting at these levels of exposure using asbestos exposure risk assessments from some of the governments in Western Canada, the Ministries of Labour and WorkSafe type organizations. And then we also used expert judgment, which really was talking to Paul quite a bit. I will say as well, we used some of the data that Paul presented already from the occupational disease surveillance system. So we knew that there was some workers that were very likely missing from our 2006 estimates, primarily around building maintenance, right? So Paul showed some of the increased risks that we were seeing in folks that work in building maintenance, and we wanted to add those workers in because we kind of had this real world evidence coming from the ODSS that say, hey, there's actually a risk that exists in Canadian jurisdictions in these jobs, for mesothelioma, which is really only caused by asbestos. So we use that as kind of real world evidence to inform our estimates. Next slide, please. And so here's what we have. So I'm going to show you a little bit of our updated estimates. So recall that in 2006, we estimated around 150,000 workers were exposed. In our updated estimates, we are much more confident that we're capturing the real exposed worker population. So we estimate around 235,000 workers exposed in 2016. And these are the top 5 in terms of size of group, exposure groups by industry. So you'll see there specialty trade contractors coming in with a high number there. All of these, not all, but most of them are really coming in the construction of buildings, which makes sense because we know that the exposure is occurring in these asbestos containing materials that are in our built environment. And on our CAREX website, you can see this exact graphic, and we also show you the proportion of that total industry exposed. So of everybody who works in the specialty trade contracting industry, we estimate around 14% of them have current asbestos exposure. Next slide. Just to dive a little bit deeper in terms of the top 10 industries. So these are the same ones that you're kind of seeing that you just saw, but showing you out by also the level of exposure. So you can see where we have folks that could be in the low, medium, and high exposure groups. So most of the exposure we estimate now does occur at low and moderate levels, but there are some workers primarily who are working in asbestos remediation, so where we really know that they're dealing with an asbestos contamination problem, that are still at risk of high exposure. But you can see that it does come through in terms of the number of workers exposed when we start to think about building maintenance. So a lot of those public buildings where custodial staff and other folks who might work on a boiler, for example, are coming up in schools, so in educational services, in hospitals, and nursing and residential care, where these are sort of legacy older buildings that were built prior to the 1980s, and so we know have asbestos within their building materials and could be exposing workers. Even if it's at low levels, we still would like to estimate those exposures. Can you just click through there, Paul? I think there's an animation on the slide. Yeah, so it's just showing you the same data. Oh, sorry. There we go. This is the same exact data, but just shown to you in a nicer format that you can see on our CAREX website. So how does this kind of break down in terms of these industries and the levels of exposure? So like I said, primarily exposure is in the low and moderate levels, but there are these sort of groups that have higher exposure, primarily in especially trade contracting and building construction. Next slide. This is showing you the data by job title. So I was showing it to you for industry before. Now, when we look at job title in terms of size of exposed groups, what do we see? You can see here that workers across a variety of different job titles are making up those industry numbers. So lots of carpenters, people who are trades helpers and laborers, electricians, custodians, building superintendents, other folks who might come in contact with some of those high temperature types of exposures like plumbers, a variety of different workers. So really it isn't concentrated into kind of one major job title. It does really spread itself across a variety of different jobs that could encounter asbestos containing materials, either workers who might know that they're going to encounter it and perhaps are taking precautions, but many who might not know that the materials contain asbestos. So kind of looking at exposures there by job title. Next slide, Paul. And I think this is my last slide. I just wanted to put this one up, which kind of shows our top 12 exposures across CAREX Canada in general in terms of the size of the exposed group. It also shows you the confirmed human cancer sites as well as the sites where cancer is suspected, just to show you that, we have a lot of exposures occurring in Canadian workplaces that are known or suspected to cause cancer. But you can see asbestos there still showing up as a very important exposure. So even though it is banned for new use in Canada now, which is a huge win. We still have a lot of people who are exposed, just given that it is such a prevalent building material to this day, given its really prolific use in buildings prior to 1980 that still make up a lot of our public buildings today. So, eventually we will have asbestos be a legacy exposure, but right now it's not, and it still does really come up in that top 12 exposures. Like Paul said, exposures have likely gone down dramatically since the mid 20th century, but given that it's quite a potent carcinogen, it's still causing cancers and other respiratory diseases today. And so it remains something that we have to remain vigilant about in the sort of occupational cancer space. And I invite you to visit our CAREX Canada website to take a look at our asbestos estimates, but also all of these other ones that you can see up here if they're of interest. And I'll pass it back to you, Paul. Paul, I think you're still muted if you're trying to talk.
Sorry. I'm kind of an amateur in the, I volunteered to be to host the slides. Maybe it should have gone to somebody who's more technically proficient than I am. Anyway, sorry about that delay. Just to kind of come back, and I think that was a great overview of the fact that we're going to be having, continuing challenge with asbestos exposure and the health impact of it going forward. But our current patterns, or the recent patterns, has been to see this plateauing, and some evidence, at least we can see it in Ontario, we've seen it in British Columbia, and I'm sure once we get more recent data from some of the other provinces, I'm not sure, but I'm certainly very hopeful that we're going to be seeing it across Canada. And we're seeing it, I guess, most strongly, at least where we've been able to look at the data in detail in pleural mesothelioma. And pleural mesothelioma is the one that's kind of associated with, most strongly associated as the type of mesothelioma that is caused by high exposures to asbestos. We see the drop in both men and women now in Ontario, and but I'll tell you that in Ontario, when we look at peritoneal cancer, the pattern is less clear. It's a rare kind of asbestos-related mesothelioma, and it fluctuates a bit. But what is becoming clear is that the rates for men and women have kind of converged. They're very similar for peritoneal mesothelioma. Another pattern that we have seen in both Ontario and BC, where we've looked at the really detailed data, is that people being diagnosed at an older age now, so that even as the rates are dropping, we still have a lot of cases amongst people who are quite old, and that means that their working time when they got exposed could have been actually earlier during these high exposure periods. So that may partially explain why survival has not improved overall in Canada, not very much that we can see, because the chances of survival when you're diagnosed at an older age are not as good. But it may also be an indicator that that wave of mesothelioma due to exposures that occurred many decades ago hopefully will begin to wane now and go down. So we're hoping that eventually things will look even better. But taken together, we would put these things to indicate that we are transitioning to rates being driven from very high exposures in the farther past to a large number of people still being exposed at a lower level, occupationally at the least. And when you look at, when you look at the Nordic countries, this is what you see. And the Nordic countries, for those of you who don't know, were among the first to really ban asbestos and take, many decades before we did, and to take much stronger measures to try to control exposures. And so here you see men on the left and women on the right, and the rates for mesothelioma, and you see that kind of peaking that happened in the Nordic countries happened, earlier, maybe certainly by 2000, 2005, some of those countries were already dropping. So, a good 10 years or more before our rates began or had begun to drop. But that's when you look at men, and when you look at women, you get less of a clear pattern. Now, I want to point out that the scale is different here. That the risk among women is lower than in men, and that's because of historic employment patterns. Now, the difference between men and women in the Nordic countries is less than it is in Canada, which is probably a sign of actually more egalitarian, perhaps, employment patterns in the Nordic countries. This is maybe the one of the only negative things I can think of with that egalitarian employment pattern, maybe the hazards that are associated with that. But you see here that the rates in women, with the possible exception of Denmark, they're really not really showing that they're decreasing in women. So that's something to be, I think, concerned about in our future as well, that we may not see things necessarily decrease as much as we had hoped. So, but it also, you can see that the rates still remain relatively high in the Nordic countries, despite taking actions decades earlier than we have in Canada. So we may see those decreases more in men than in women, at least initially. Another thing that we might expect in the future is that environmental exposures will become more important, at least proportionally, in terms of their place in sources of exposure leading to mesothelioma. And as that happens, and as more equal employment patterns also come into place, you'll see perhaps the rates of mesothelioma among men and women come much closer to each other. Another pattern that you'll see, I believe, is, and we've begun to see it here in Ontario, is that there was a time when there parts of the province, most notably around Sarnia-Lambton County, where the Holmes Foundry was, but also the petrochemical industry, which used a lot of asbestos, currently is, had rates that were perhaps 10 times higher than the rest of the province. And now it's only around 5 times higher. So what's happening is, really, when you're talking about the primary areas of exposure being amongst building, maintenance, repair, demolition, things like that, and environmental exposure in residences and other things, what we may see is that the patterns are going to maybe flatten the crowd around the country geographically more than they have been now. So we'll continue to see changes going in the future, and some of this is, speculating, but at least we're seeing things moving in a positive direction now. I think certainly in these last few years, for the first time, I feel comfortable saying that. And I'll end there, but I just wanted to mention, Anya mentioned before that the conference, the Canadian Mesothelioma Foundation conference, which is coming up, for those folks who are here in Toronto, or at least or in Ontario, I would encourage you to attend if you can. And the information is here for that. I should have mentioned that we would be taking questions at the end, but of course, I forgot to mention that as a course of it. But we're happy to take any questions now. If you like, you can put them in the chat if they aren't already there. I haven't been able to see the chat because I've been hosting. But you can either put them in the chat, or if you'd like to ask them yourself, you can do that as well. So thank you very much for your attention. Thank you, Cheryl, for presenting with me, and Anya for introducing.
Thank you, Paul and Cheryl. I'm going to pause the recording or stop the recording at this point, and then we'll open things up for questions.